One of the most common questions that we face in our clinic from a would-be mother is, Doc, which one is better, a vaginal or a normal delivery or a planned cesarean section? And can I handle the pain of the normal delivery? I, Dr. Indranil Saha, one of the senior consultant of Bhagirathi Tanitra Hospital, Gordon Street, will discuss in details about this. Now, what is a vaginal delivery or the so-called normal delivery? When the baby comes out through the vagina, we call it a vaginal delivery. And what happens? Your uterus of the womb contracts, the neck of the womb dilates, and gradually the baby comes out of the vagina. No, it's not that plain and simple because there can be complications. Now, there are advantages of normal delivery and disadvantage. So we'll talk about the advantages first. What are the advantages of normal delivery for a mother? For the mother, it is an early recovery, less hospital stay, less pain, less chance of infection, less blood loss, and the mother can initiate breastfeeding very early. Now, what are the advantages for the baby? In the normal delivery, as the baby comes out through the vagina, the baby's lungs get squeezed and so the fluid in the lungs comes out and the baby can breathe easily. Contrary to it, in a cesarean section, when you deliver the baby directly, the fluids are trapped in the lungs and the baby sometimes has difficulty to breathe, which we call the transient tachypnea of the baby. The other advantage is when the baby comes out of the vagina, the baby comes in contact with the good bacteria and therefore the gut immunity of the baby improves. And it has also been seen that if a baby is born vaginally, there is less chance of childhood obesity, less chance of asthma and neonatal death. Now, like any procedure, a normal delivery or a vaginal delivery has disadvantages. What are the disadvantages? The disadvantages are increased chance of perineal tear, increased chance of urinary or rectal incontinence. And that happens when you have an assisted vaginal delivery. Now, what do we mean by an assisted vaginal delivery? When we use a forceps or a ventouse to deliver the head of the baby, we call it assisted vaginal delivery. Now, what is the incidence? Usually 10 to 15% of the vaginal delivery, you need some help like some assisted with forceps and ventouse. And a mother who is delivering for the first time, 1 in 3 will need assisted vaginal delivery. And if you have to use forceps or ventouse, there is increased chance of perineal tear and the incontinences. Now, not everyone can go for a vaginal delivery. There are certain criteria which we have to follow. One of them, the baby's head is down. Number 2, the baby is healthy, which we get from the ultrasound report. The baby's heart rate is fine. The placenta is not covering the neck of the womb or the placenta is not very low lying. Now, if you go for a normal delivery, it doesn't mean that you will achieve a normal delivery. In certain cases, we have to do an emergency cesarean section. Like when you are having a regular contractions, but the cervix or the neck of the womb is not opening, or the head of the baby is not coming down, or the baby is in distress, like when you do a CTG, the baby's heartbeat is going up and down, the baby's heart rate is going very down and is not recovering, or the baby is passing some poo, which is called meconia. It's a sign the baby is distressed and baby needs to come out faster. In that case, we do a cesarean section. Or if there is sudden blood loss, that means the placenta is separating, which we call abruption. In that case, you may end up in a cesarean section. Because at the end of the day, we want a healthy mother and a healthy baby. Now, what is best for you? You can go for a normal delivery or you can go for a planned cesarean section, because planned cesarean section is something abnormal. There are certain indications where you have to have a cesarean section. Like if the baby is breached, that means the head is up and the body is down. If the baby is lying in a transverse position, or if the placenta is covering the neck of the womb, the mother has some infections like HIV and herpes, or the mother has some medical conditions like a severe heart disease where she can't bother the pain of the labor. So in that case, you have to have a planned cesarean section, and that is not abnormal, it is normal for you. Now, if you're thinking of a vaginal delivery but you're afraid of the pain, don't worry, because we have all the facilities of epidural or painless anesthesia in our unit. Number 2, if you have a cesarean section in the past and you want to have a normal delivery, you can give a go, because vaginal delivery after cesarean section is quite safe and we do that. But One thing I have to tell you, don't go by peer pressure. What is your friends doing? What is your friends saying? What other family member is telling you is not right. You know your body best. You know your limitations. We are there to give you all the informations, the pros and cons of every procedures. You take the decision and we will support you as a team. Yes, achieving a vaginal delivery is a teamwork, and the obstetrician, a pediatrician and anesthetist who will give you a painless epidural anesthesia is part of the team. So you select your team carefully. Thank you very much for your